Hello, everyone. Thank you for joining. We will be starting our masterclass on writing an original research article. And thank you for joining from anywhere from where you are. It's great to see so many people interested in this topic, which is so fascinating and so close to my heart. So this is an initiative from Elsevier to promote a culture of evidence. It's our grain of sand so that anyone can access these best practices on how to conduct a healthy, ethical, transparent research. Please, any questions, send them through the chat or the Q&A option, and me or the rest of my colleagues will be answering the questions as they come along, if they're related to the masterclass or technical difficulties or the content itself, or other webinars and so on. So my name is Ximena Alvira. I'm a medical doctor by background. I'm also a doctor in neuroscience and have practiced in basic research for several years. I'm also a medical writer. I have done different things in medical writing for many years now, and I still do. It's something I'm passionate about. Finding errors and get paid to do it is great, but really it's a fantastic discipline. And I have practiced in primary care, emergency medicine. I also have done, as I said, basic research, and now I work as clinical and research manager at Elsevier, where I conduct this series of masterclasses with our customers, also some like this one, for anyone to join. And and I do all kinds of fun stuff and interesting things in my role. So the objectives of today's session, which is supposed to run for an hour, I hope I can make it. Usually these sessions run for 2 hours or so, but I try to make that content as concise as possible, but still useful enough for you to take home many takeaways. So it's based on giving you recommendations on how to write the essential parts of original manuscript, because original manuscripts, as you know, are difficult to conduct, an original research, difficult to write, and they are definitely screened very closely by the peer reviewers and also by the journal's editorial board and so on. So I think they deserve the spotlight on their own, as they should be. At the same time, as I said initially, we want to promote the best practices in research, in writing, in sharing research, also ethical, transparent, healthy research that we promote and that anyone and everyone should conduct. For those of you who are interested, we conducted another session on June called From the Editor's Perspective. Just a few takeaways. The main takeaways of the sessions were the editors do look at the recommendations, including the journal's guideline for authors. For those of you who did not attend, these were the main takeaways. Also, so you should take time reading them very carefully, but I will go through this also during this session. And some of the main parts that editors look at when they screen quickly through your manuscript to go through that first pass of screening will be the title, the abstract, and the letter to the cover letter. So draft them carefully. But if you're still interested in watching that session, you can go to our Health Research Development Program. You can search for it in Google, but also I think we will post a link. And you can watch the replay of this session and any other session that we conduct. So you can watch it in English or you can watch it in Spanish. So let's get to the nitty-gritty. So because of these reasons why articles get rejected that you will watch in From the Editor's Perspective, I honestly think that about 90% of the reasons why manuscripts are rejected, at least in the first moments where they are seen by the editors-in-chief or the editorial board can be avoided with good practices when writing, and making sure that enough attention to detail is placed to draft your article. So one thing is the research you have done, and definitely that requires all of the attention. But once you have your data, it's important to draft it in a way that you think as a medical writer, not as a clinician or as a scientist or as any other healthcare provider or researcher. You must think as a medical writer, because it is a job. They gave me 10 days to draft an article and to write it and then to submit it. So it can be done with good practices and with a sort of a guideline, which is why I'm going to give you a structure. So what do we have to keep in mind when we're writing all the time is you have to write an article that has a clear and useful message. This has to be done. This will be done with the recommendations I give you, but it's one clear and useful message. We're not talking about 5 clear and useful messages. It's one. The conclusion is going to also tie down that one message, but the conclusion is at the end of the writing. So just start thinking about your clear and useful message if you're already in the process. It has to have a logical manner. It has to start with a good introduction that tells me what we're going to find in that article, not everything that's been written about the topic that I'm talking about. Then that has to be followed by a methodology that actually was used, not everything I added in the protocol. Every method has to have a result, and that's I'm going to reinforce that throughout the session. And the most interesting results, those that are impactful, that have a clinical and scientific relevance, will need to be discussed. And that is easy to read. And this is the most difficult part. We're not used to writing that often. We're used to reading and maybe synthesizing what we read. But writing is a completely different profession even. So we're used to writing in ways that are not scientifically make sense. So I'm also going to touch upon a few tips and tricks on how to write, but there are definitely no formulas, no magic formulas. It's a question of exercising your writing, but it does have a method too, and you'll be able to do it if you're used to writing a lot or get used to it. So this is how you read an article. You start by the title, abstract, keywords, then you follow by the introduction, methods, results, tables, and figures, right? But one for me was the aha moment is when I learned, when I started writing as a medical writer, that actually you should start by the tables and the figures. So initially I started by the introduction maybe, or the methods, because they seemed to be easier because they were already in the study protocol. But definitely when you're writing, especially in clinical studies, you need to know what you're going to find. You need to know what you want to discuss. You need to know what is really, really important and impactful. You need to assess your results because you have a data set, a huge data set. You have your case report forms, or you have the protocol, and then everything gets mixed. And the only way to understand clearly what you have is starting by your results. And the best way to start are the figures and the tables. Then your results, the written part, then you continue with the methods, because now you have exactly which results you're including, because they're the best results, not because they're negative, you shouldn't exclude them, but because they're impactful, they do change some notion that we have, they do fill the knowledge gap that we were trying to answer. Then if you're not doing that, then even don't bother to write the paper, don't spend that time in writing the paper. Then you are following through by the discussion, which could be done at the same time, probably as the introduction. And finally, you create a beautiful title and abstract keywords. Again, the title, abstract, and but not the keywords. I go through how to write it well and what makes an impactful title in the previous session in June. So take a look at it because it has interesting information. So why the tables and figures? Well, You know, as well as I know, that we're in a very graphic world now, very graphical world. Everything is through images. The next thing we'll see is a generation of TikTok papers, maybe, but definitely images play an immense role in conveying the importance of your results. They also improve the quality of your results for the reviewers, for the editors in chief. The editor in chief for the reviewer editorial board is essential to understand uh, through a quick view, what is it that you wanted to tell, and if it's important enough to be accepted in their journal. They're always seeking for interesting things, well written, well detailed, or well written rather, to include in their journals, because they want their journal to be more visible. And the way to be more visible is that people cite you as an author. So you need to create an impact, definitely. And the figures and tables might do that impact. They also save time, and space. Not time when you're doing them, because I spent about 3 days doing my tables and figures, 3 whole days. If I had 10 days, 3 days were dedicated to the tables and figures, because they take time to be perfected, to be done in a careful way. They do save space because you have a limited space. You have 3,000, 4,000 words. So you need to save space for the discussion, which is the most important part when it comes to providing useful insights. So you need to leave about 1/3 of the article to the discussion alone. And they reduce the length of the manuscript, which ties with what I've just said. What to choose when? So this is a question that you might ask yourself, okay, when do I use a figure? Should I use text, or when should I use a table? And you'll see that I take this from editage.com. It's a page that I named also in my previous masterclass several times, because I think it has great information summarized in a few minutes of reading. And it has this great table that you can use to respond or to answer to that question. So I'm just going to change the pointer. When putting your data into a table would mean creating a table with 2 or fewer columns, then it doesn't make sense to create a table. Then use text. And so on. So just that, capture the URL, the link, so you can go back to Editage and find this information. A few pointers that are very important when drafting your tables, essentially. So first, design the table. This is a must. This is something that you should do, because otherwise sometimes the columns end up outside the page, which is absurd, but I've seen it. So first, draft your table. So I will have 16 columns. They don't fit in a page that is vertical, so I will turn the page in a horizontal way to make the table fit. You add page breaks or section breaks to do that. You just turn the page of the table, not of the whole manuscript. Then you add the number of columns, then you add the number of lines, then you add the labels, then you add the numbers. And in this way, you're creating a table that fits your page. You can adjust to fit the page anyhow, and also make the columns symmetric, which is even prettier. You should use a clean and legible font. If you have already a font that has been decided by the guidelines for authors, and this is where I repeat, you have to look at the guide for authors or author guidelines. They will say you have to use Times New Roman or Arial or any other font that they like, but you can decrease the size to make it legible and to make sure that there's sufficient space between the columns and the rows. And I'll show you examples in the next slides. You must add a descriptive title and a legend, because your tables will sit outside the manuscript. If a master's thesis, usually you have the result, and following it, you have the table. When you send the manuscript, the tables will sit outside, even in a different Word document. So they must be understood by themselves. They have to have a descriptive title and a legend that has every single acronym and abbreviation symbol that you added to the table or the figure. They're placed usually after the references, unless the author guidelines state otherwise. If they say no, place them within the text after following the result, then you have to do that. That's why you should always follow the author guidelines of the journal that you're targeting. What I usually did is I used the same template for every article, every manuscript. And then as I went along and I understood the literature and found similar articles, then I went to selecting my article, but my journal. But I didn't do that as a first step. You can do that, but then you're subject to the author guidelines. So I suggest you choose around 5, your shorthand, 5 shortlist around 5 journals that have similar author guidelines, at least in the length of the manuscript, because then you would not have to make so many changes when you have to resend your manuscript, which usually happens. But that will be the targeting your manuscript, selecting your journal is another topic. Very fascinating too. When you're drafting your table, also when you're adding the numbers, make sure the percentages add up to 100. This is one of the most common mistakes, and you'll see it in an example. And it doesn't make any sense because your population, it's an absolute number. It's not a decimal. No, in the population, it has to add up to 100. Well, I'll show you examples, but the decimal places, try to unify them to make them look like a uniform column, because I know there's statistical analysis that request that you have more than one decimal place. Maybe the author guidelines say always add one decimal place, and you have to, but at least make them uniform. So you have an absolute number and then a decimal, add to the absolute number 0.0, for example, to make them uniform. And I'll show you a little bit more of this. If you're not clear about how many decimal places you should add because of the statistical analysis or the size of the population, which also conditions the number of decimal places you can include, then I suggest you take a look at the science, this additional reading. Too many digits, the presentation of numerical data is a great one, and you can use it to go back and forth when you're building your manuscript to understand what works best with your type of research and your table. And then also 10 common statistical mistakes to watch out. This is great not only to draft your article, but also to review your article. It's great to understand what are the most common statistical mistakes. Oh, another suggestion, for those of you who have access to Clinical Key, then you can find more information on how to draft effective graphs and tables. So we start with the examples, which I think are the best way to understand or to convey what I'm trying to say. All examples from published articles. So I'm not criticizing the work. I'm just going over or commenting how they could have done it more efficiently to convey the message clearer. Because as I said in the beginning, it has to have a clear, useful message, and it has to be easy to read. So always think about what is the best way to convey my message and the way I can make it clear for everyone. So this is a published table, and immediately what I saw were several things. And I'm going to add them here. For example, the total percentage does not add up to 100. This is what I mean when it has to add up to 100. If the population is 66 and we have this should add up to 66, this has to add up to 100. There's no way around it, because otherwise, where is the rest of the population? That would be the next question. Where is the 3.3 people, the 3.3% of the population that are not included in the table? The table has to be understood by itself. I don't have to go back to the written part all the time. And if they don't, then it's going to be inconsistent. This decreases the quality of your paper. Maybe you lose a great opportunity to target a high impact journal. So do this with care. Also, the individual groups do not add up to 100. If I have a 45% here, 4.5, this shouldn't be 50%. Something is missing there. And I don't need to answer that question. It's the responsibility of the authors to do that. The percentage symbol. If I already declare that this is a percentage, I can remove the percentage symbol from all the column. The items should be centered. This might be a question for the editorial board maybe, but anyway, try to do it. And it has spelling mistakes. And this is definitely something that editors look at. If your paper has spelling mistakes, they will not correct them. It will go through without being corrected, which is terrible, but also they might reject it. And it's very possible to reject your paper if it has too many spelling mistakes. That's a fact. They will not spend time in trying to understand what you're trying to say. So just if you're not sure, if English is not your, if it's not your language, your native language, make sure you run your paper through someone who has a better English or through a service that can at least correct your grammar. Anyway, Word does a great work now, and Grammarly also can help you. So just check the difficult terminology, check it in Google and see how it's spelled right and make those corrections. So what I did here was redo that table, and you can see several differences. It has a descriptive title. Anyway, it has, as the one before, it has the abbreviations, acronyms, whatever I had added, it's described in the legend. But also I changed, you can see there are no decimals here. I standardize everything, but it still gets the message across, because what I want to know is what's the etiology and the most prevalent etiology of chronic kidney diseases. What's the distribution of the population in that sense? So you can see I also changed the order. Before we had urinary system anomalies, then the next most frequent one was neurogenic bladder. But what I did here is make sure that neurogenic bladder was the second one because it's the most prevalent. I highlighted also the numbers in bold, which I think makes sense. Everything is centered. Every data or concept is in a single cell. If I had added the grid lines, you would see that everything is in a single cell, because then I can make adjustments and nothing will get moved a lot. The numbers in the middle of the line of the lines, which makes it prettier. Also, what else do I have here? Now everything adds up to 100. If you added this, it would be 100, and this would be the total population. So you see there are differences regarding the initial table. And this is what I mean when by drafting a table with care. Also, I removed the lines, the separating lines, which were very distracting. Just adding a line to separate the top, the bottom, and the titles would be enough. Oh, this is the recommendations I had given before. First, design the table, then add the labels, finally add the numbers. Also, use a clean layout and legible font. You can see there's enough space between the lines and the columns, and it has a descriptive title and legend. When I said what to choose when, well, I think this is a confusing paragraph for me. It's not very easy to understand. I don't like numbers a lot. And then I see many numbers here. So to understand really the importance of the results, I would have used a table, right? Because I think it's a dense paragraph with many, many numbers, and it's not the best way to show your many results. Also, there's the data is not organized. There's not much separation between the types of results we were looking for. There's inconsistencies in data. You have elective surgery, 162 in some places, then you have 164. So it doesn't make any sense. You have also inconsistencies in the number of major procedures. The language is not appropriate, but anyway, we're talking about the numbers and how to depict the best way to depict your results. Well, definitely this is, for me, it's not the best way. But they also did a table, which is incredible because you're duplicating information. It doesn't make any sense. Here, again, we fall in the same trap of not knowing exactly where the population came from, because we have a total population of 1,211, but then we have numbers that don't add up to that total population. So what happened to the rest of the population? Why is it not here? Where is it? And also the percentages, 90%, then 30, then 2.6. Where are the numbers coming from? It's not easy. It's not, from the start, we don't see it. So why make our lives miserable and needing to go back to your manuscript to understand, okay, where is this coming from? Do it in an efficient table. So I think there are several things that could be corrected here. And also, if we have morbidity, mortality several times, maybe there's a way to avoid this repetition by adding them as a column I don't know, but definitely there should be more time spent in correcting this table. So I hope you can see differences between the tables that I'm showing, how easy is it to understand a table that looks like this, that is clean, that the numbers there are no decimals, that everything adds to what they should, by that whether it's the total N or 100, because it's a distribution of the total N. And nothing would be different if I said 21.9 females and 14.1 males. There's no difference to that. I'm not making comparisons. So why add a decimal? Because it doesn't make any sense. It wouldn't make a difference. The population is this one. It wouldn't make a difference at all. So draft them carefully. If you see tables like this and you like them, save them as great tables, because they will help you through the process when you are in the process of building the tables and figures. So now about the figures, you have to be very careful what is critical, what is necessary, what is nice to have. Think about the main takeaway and how you want it to be shown. So whether it's a table, but if it's a figure, which figures you want to use. There are many figures. Well, this is definitely not an effective figure, and we could do without them. So these are three pieces of information you can look for in Google and find additional information of what not to do. And then again, one of the good recommendations is when you read articles, save the pieces that you liked, the introduction, the discussion, the title, the figures, the tables, anything, because then you have a library of good pieces of articles, and then you will have a guide as to how to write yours. Don't use 3D or special effects when you're drafting your graphs, because you can certainly confuse the finding, the result itself. So you have this result, and I don't know exactly what you meant. Is it 58? Is it 49? Is it 60? I don't know. But when you do it in a bar graph, you can see that age group was 62, and I never would have guessed it from a 3D image. You use them for posters, but never for the published article. Also, if you cannot ensure a good resolution in PowerPoint, you have to use something else. There's other software that you can use, but the journal will require a definite resolution, a certain resolution, usually 300 dpi, and you have to conform to that. Otherwise, either you get a rejection if you have too many non-followed items of the guideline for authors, or you will be sent back your paper, and that will certainly delay all the process of sending your manuscript and getting it accepted. So now you're done with the tables and figures, and what we have to do then is draft the rest of the results. And this is a very important part, because it does speak to the transparency of your work. What your results should contain should be standardized throughout the world. So this is something that I'm very in favor of, is you're not doing something that nobody else has done. Almost everything has been done before. I mean, every type of study has been reported, so you don't have to reinvent the wheel, which is a great thing when you come to think of it. So there are guidelines for that. There is a guidance for every type of methodology that you used, for randomized controlled trials, for observational studies, for economic analysis, for basic research. There are guidelines. Where can you find them? Here in Equator Network. It's a great network. It groups everything. And when you're starting to think about your research, you want to do an observational study, a cohort study. If you read what you will need to report, then you know what you need to include. I was just thinking that I will talk about this in the next masterclass, which is in November. So I will not talk a lot about this, but definitely to report your results, check Equator and find the guideline that you need to use, depending on your type of study. But some things that you must focus on. Make sure the results are consequences of the methods used. However, we're starting by the results, not the methods. So you have to keep it in your mind when we do the methods. Make sure the results are answered, the questions raised in the introduction. Again, the introductions, we have not yet touched it. But it's important that in the results, you do not add or introduce absolutely any interpretation of your data. The outcomes, the objective, the results, the endpoints, variables, whatever you want to call them, must be presented objectively. So adding surprisingly, we found, or contrary to what we expected, or this is very interesting, should be the realm of the discussion. And even there, be careful. But anyhow, don't add any of those interpretations to the results. And as I mentioned before, just grab examples from papers that have a similar methodological approach, or that you like what you're reading and you understand it perfectly and you think it's a great result section, how they wrote it and how they added their graphs and figures. Just save it with that name, otherwise you'll forget why you saved it. One of the main reasons of doing figures and tables is that you don't have to duplicate that. You save space and time. You don't have to duplicate that information again. But in this example that I showed you before, they definitely did that. So this is one of the reasons why people sometimes tend to think that adding twice the results is what should be done in the table, should be described, and also that if we write them twice, maybe they'll seem more relevant and important. And this is not true. Your table is the most efficient way and figure to show the results. So let me show you some more examples of results. So for example, here we have this this article that has been accepted for manuscript, and you see how short the description of the population is. It just requires a few details on saying, okay, this is the population that we finally obtained, and what's in each arm of randomization in this case. And the patient characteristics are balanced, are shown in table 1. So your table 1 always is a description of the population. And this ensures that all this information that goes in that table doesn't occupy all of the space you have for the results, because you have a limited space. So adding all the comorbidities, concomitant treatments, preferences, anything that you included in your demographic table would take up a lot of space. That's why we include a table. If you haven't already seen this, I think this is the best suggestion to draft the results in a clear and useful way, in a logical manner. It has so many benefits. Adding numbered and headings and subheadings. It's easier for you to understand and to group results, right? Now you have grouped your results, so you can add your titles and subtitles. It's also easier to answer to the reviewers, because you can say, well, in section 3.2 efficacy, we made this change. Whereas conversely, you would have to say, in line 153, we made this change. So it's beneficial for so many reasons. Also for the readers, for me, it's much more pleasant to read something that is broken down in smaller pieces of information, because attention span is very short in many people, including myself. So breaking down information is the best way to convey the importance of your results and your message. So unless the author guidelines state otherwise, you can alternatively use just bold headings and subheadings, but definitely use them. I haven't seen an author guideline yet who advises against breaking down your results or the rest of your article in headings and subheadings. So start doing that as a practice, and you'll see how beneficial the results and efficient it results to the drafting of your article. Headings and subheadings, very important. So now we go to the methods section, which sometimes is the place where we all start, because they're usually in the study protocol, but definitely I wouldn't, because sometimes the study protocol contains many, many things that we couldn't achieve because maybe we didn't have the population, maybe we run out of money, maybe. So we don't know. So that's why starting by the results is more effective than starting by the methods or anywhere else, any place else. So remember, in the methods, we want to ensure there's a clear, useful message of what we did or of how we did it, a logical manner, and they should be easy to read. The methods are the place where we write everything that we did. So it's so important for them to be explanatory that we can go there and see, okay, what was if we're basic researchers, the dilution, what's the species they use, what's the antibody, or where was the study conducted, what were the eligibility criteria. Everything should be described clearly and ethically in the methods. Also, if you're not able to put everything in the manuscript itself, because you have, again, limited space, and you can have, I don't know, 100 words maybe, or depending on the amount of methods you have to include the most important ideas, you have to include the most important elements of your methodology. But if they don't fit, you can use the supplementary materials and methods. However, these are not peer reviewed, so just be careful to do them very carefully and write them with a lot of care, and also in a way that, as I said, they're transparent. Also, you can use references. It's not very common in clinical research, but if you're using a methodology, you're combining basic and clinical research, you can say we follow the methodology of so and so, and you can cite the methodology described in another paper. That's something that is commonly done. But anyhow, it's the place where you have to have a lot of transparency. Many papers are not rejected, but they even are published, but then they get retracted because faults in the methodology that some other researchers noticed, and the reviewers were not able to capture easily, because the reviewers don't have access to your raw data. So they have to believe in what you say. So be very transparent and very ethical in this part. Also, as I said, with the results, it's great that you already have a format that you want to use. You have your organization of your results in the way that you liked it, but usually the first part is the population, the description of the population. So you will follow the same order in your methods, and you can see either numbered or not numbered sections, but the first paragraph should be dedicated to describing how that population was collected with the eligibility criteria. So the first paragraph of your results will be what was the population that we finally included in the analysis of our study, and so on. And then you continue with the endpoints. So the first endpoint was progression-free survival. This will be the methods, how you measured progression-free survival. So the second paragraph of your results will be what was the progression-free survival of that population that you studied, and probably with a graph of a Kaplan-Meier graph, for example, and so on. And you continue doing correspondingly, and in this way you have a perfect correspondence of the methods with the results. There are no methods without results and no results without methods. So this is one of the examples that I show, and the brick wall just says what I feel about this amount of writing that is dense, that is difficult to read, that is immediately, it puts you off. It doesn't lead you to want to read the materials and methods, which should be very important. Almost nobody reads it, but it's a great source of mistakes also, and of retractions, as I said. It's a dense text. It's difficult to read. It has no breaking points. I wouldn't see a reason why we would do this, unless it's because we don't know otherwise, right? But adding titles and subtitles, numbered if possible, if the author guidance allow you to, would have been so much more pleasant for anyone to read and to understand. And if you had to respond to a review, to the reviewers, it would be quite challenging to say, well, in the line 750, unless you have numbers at the side of the page. But anyway, it makes it more difficult. So this is the contrary to what I would do. The most difficult part to write is the discussion. So we have written already, supposedly, the tables and figures, which took us 3 days to write. Then we went with the rest of the results, which took us half a day, maybe, or a day to write. Then the discussion comes, and again, we spend around 3 days to write, because it's the most difficult and hardest session to write, and also the most important. It shows what you interpreted of your results. It also should highlight the importance, the clinical and scientific relevance of your work. It has to show how much you know about it. So you have to have read a lot about it also, probably. But anyway, this is another great source of rejection because the discussion has to be interesting. It has to show knowledge. It has to be creative and so on. But it's very important also that you can convey what makes your study unique, because when you read it, it's going to be the introduction. But when you write it, you need to tell us, why did you do this study? Why was it so important for us to read it? Why it's so important to be published? Just because you did it is not important enough. It is, but not for the journals. Remember, we're talking about medical writing here, and you're trying to survive in about two papers, 2 articles being published, being uploaded in PubMed per second or something like that. You're against a lot of competition. So you have to convey that importance, of course, from the start of the protocol even. But if you haven't, and your article is, your research is okay, not bad, but it's not going to change how we practice healthcare. But you need to make that point even in the discussion. Even if your results are not that impactful, you have to tell them in a way that they result impactful for someone, because they have to be important for someone. So how to structure the discussion? So as I said, the first paragraph should be where I recap a little bit on why I did this. Why is it important? Is it causing a lot of burden? Is it causing a increased length of stay? Does it cause a lot of safety issues? Is it a problem because quality of life is decreased? Are any policies affected by my result? Any policies, government policies, health, my institution's policies, anything that you think can be impacted by your results should be put here. Also in the introduction in some way, but very importantly in the discussion. So remind me of the importance of what I have just read. And if you remember from the first session, if you attended, I say that after your figures and results, figures and tables, probably the editors will look at the first and last part of that discussion, because they should have the importance of what I have just read and also the conclusions. So this is an example of an article on allergies. And so the first thing that caught my attention is that this is the first clinical trial. I would be careful with this, because you never know how much time you're going to spend in your article is going to be being accepted. So you might have another clinical trial being accepted before. This doesn't make it more important. It could be, but you're never certain of that, because there's also preprint servers where you upload articles. So it doesn't mean that is important. What should be important is this a problem in the population? Is this something of interest to the general population? Does it happen often? What I'm going to show, is it going to affect in anything? Might affect the treatment of these patients at all, or the diagnosis, or the prognosis, or the screening. So this is what I would have liked to read. Also, I hate the abbreviations, and you will see in the when I come to the introduction, use the least amount as possible, because these are probably not standard ones. This might be a standard one, but once I reach here, I don't know what they mean, and I have to go back to the introduction. But anyway, if you have to use them, at least use those that are common and frequent, so we don't have to go back to the introduction. So anyway, it says it's the first trial to report the efficacy and safety of Timothy grass in this treatment in North America. So is this a common condition? Is there very frequent? I don't know. And you're not telling it to me. So I have to go back to the introduction, and hopefully I find something of interest. And I did. So I would have taken pieces of the introduction to build that first paragraph of that discussion, but I know you're writing first the discussion. So if you already did that here, then you can start already thinking about the introduction. It doesn't have to be so strict. The only strict thing for me is starting by the figures and the tables. So the introduction, you already have had something in the protocol, the study protocol. So anyway, I see things that are important. 30 million adults have allergic rhinoconjunctivitis. That's important. Maybe not so much for the American population, which is huge, but it's important. So it causes many symptoms. Interesting. It can have a negative effect on the patient's healthcare related quality of life. Very important. This is where they should have added the abbreviation, if you noticed. It can affect sleep quality, work performance, social activities, it is important. So I think we should be reminded of this in the discussion. This is what I meant. There's prescription medication. They do not have long-term effects, and anyway, and so on. So I think it is a treatment option. So this could be important. It might not look so sexy when I tell it here, but then it is an important topic, right? So remind me of that in the discussion, and not me, anyone, the reviewers, the editors, the readers. The second thing that I would do in my introduction is start discussing in the order that I presented my results, the results that I found, the most significant ones. Are they comparable to other studies? So other studies, of course, that are similar to mine, either in the disease, the stage of the disease, the dosage and the treatment, whatever I was doing, I need to compare pairs with pairs. Also, I need sort of to have the same methodology. It's difficult to compare, basic research with phase 1 studies, but you need to have similarities in order to make comparisons. And if there are differences, you have to explain why not. And this is the place where I find the most articles fail, is that they limit the discussion to stating the results again, and then the introduction a little bit, like, yes, other authors have found this, and that's it. We need to explain why. And then we have to go to, I don't know, preclinical studies. You have to find reasons why, or to your population, what were the differences in the population? I mean, this requires thinking and creative thinking in saying, what could be those differences? Could it be that my population was older, was more diseased? Could it be that the disease was more advanced? Could it be that, I don't know, we have a genetic difference, something that explains that difference? Because if you build a sensible discussion, then the reviewers might give you more ideas as to, didn't you look into this? So at least my suggestion to you is select a few articles, maybe 5, that are similar, like I said, in the design, in the condition, in the whatever you're studying, the intervention that you're studying, in the outcomes, maybe in the outcomes, so you can compare outcomes, especially the outcomes where you have to make comparisons, and the intervention. And don't go overboard. Start with 3 or 5, because you need to find studies that are the highest one with the highest level of evidence that have been published from international centers. I mean, centers different to yours, different to what you have written before, if you have, and also from people that are key in the topic that you're writing, because they could be your reviewers, and also because it's polite to do so if they wrote something impactful. So look at the citations that papers have received to select those 3 to 5 articles. Look at that study design to see if it makes, if it's similar to yours, if it has a better design or a larger population. Well, don't be afraid to compare yourself to the big ones and to the important ones. That will allow you to have better interpretations of your results. Well, this is, I think, the most important tip. So first, if we go a little bit back, are my results clinical and scientifically relevant? This is the first paragraph. Are they comparable to other similar studies? Pick between 3 to 5 initially of good studies, international ones, with a lot of citations if possible, and from key people in that topic. And if not, why not? And then you look for differences in other articles. You can go back to basic research and understand if there are differences in estrogen expression, or estrogen effects, or testosterone, differences in things that you can think of, explanations that you can think of to explain those differences. But that has to be done. It's not enough to say, we found this, and contrary to other previous published publications where they found that. You have to explain why. To make the writing easier, I suggest you use short phrases. This is a great suggestion to write anything in science, is to use, or anything is short phrases, because it gives you less opportunities to confuse ideas or to mix 2 ideas in one. Leaves no room for interpretation of what you meant in that idea. Sometimes I know you read paragraphs and you're like, what? You have to read it again because it's full of commas, of parentheses, of semicolons, and you're like, what was it? So short phrases are great. And then you can use a great way to practice. And then you can use transitional words like therefore, however, conversely, consistent to, in contrast to, and so on. So this makes the reading also a very logical and easier to understand. I will say this, if you're not saying why do you need further studies, so you need further studies because you couldn't reach the statistical power, or because many of your patients dropped off, or because, I don't know, a pandemic came. Yes, you have to state why, but not just because. Don't say further studies are needed because studies are going to happen if you say it or not, right? You shouldn't discuss results that, no, you can't discuss results that have not been presented. So that's why you always start by the results, the figures and tables, results, and then methods, and which haven't been described how you got them in the method section, right? So this is the logical manner that I reminded you of in the beginning. And as I said, do not limit the discussion to the repetition of your results and part of the introduction. I think the best way also to understand the discussion is also going back to other discussions and seeing how they're built, but definitely keeping an order in the same order as you presented the results is at least it will make you focus. That's why breaking up your results in groups of results by headings will allow you to build your discussion in an easier way and a more efficient way. So this is just one example of that, where the authors decided unless the other guidelines did request this, they decided to add subtitles. I like this very much, what this study contributes to current knowledge. I mean, why was it done? Where was the gap of knowledge? So that's the first paragraph. You can do it like this or how I showed you. But also they have numbered headings and subheadings in different parts of the discussion. You can choose to do this too. The great thing is that these headings and subheadings have a correspondence to the results. So it looks very logical. It's very easy to follow. You can trace back where that result was and find an explanation for it. So, and finding the discussion that the authors made. So this is a great opportunity to follow the logical manner that I told you about. And finally, we reach the introduction. So as I said, you can start building the introduction at the same time as you build a result, because you already have your figures and tables, which you have printed. I'm sorry, but I think it's best to print the two things from your article before sending. The tables and the figures, so you follow them throughout the whole writing of your process of your manuscript, and the author guidelines. I'm old-fashioned. So either you have it on your screen and you can cross it out in some way, but I'm sure you will miss something. So you can have it printed and cross it out with red marker, and you're ensure that you're following the author guidelines, but also that you're following what you found in your results by printing them. So the introduction should come rather naturally to you, because now you know exactly what you're going to talk about. And if, in my case, I was writing about opioid receptors and electron microscopy, I'm not going to write about how opioids are grown in East Asia and how are they commercialized or what are the medications that have opioids. I probably would talk about what are opioid receptors, what's known till now, what is not known. And this is exactly what happens when you start by the introduction, that you can go overboard and write a review of your topic. And it's not a review, it's a short section of 700 words at most, I think, of what you're going to talk about in your research. So this is the pyramid. It should be an inverted pyramid, and I'll tell you why. So what makes your study unique? It's the second place when you're writing, where you should state this clearly for everyone to know. Why is this done? Why went through the pain of doing a research? Why did I recruit patients for this? Why did I spend money and time to do this? What was the challenge, the gap of knowledge? What was the challenge that I was trying to solve? And this would be the first place where anyone who reads your article will see it. So remember the umbrella. So how to structure the introduction, and this is how I do it. So I basically divide it in 3 or 4 parts. The first part will be dedicated to knowing what is the problem. So for example, the grass pollen topic, well, it's important because what's the burden of the disease? Does it cause a lot of health quality of life related problems? Is there a lot of cost in it? Is there a lot of hospitalizations due to it, of work missing? Tell me the burden of the disease, a little bit of the epidemiology. For example, in this example, they talk about liver transplantation, and they talk about liver transplantation records. So is it a lot? Is it not a lot? Is it comparable to other countries where they also conduct liver transplantation? So, give me that. Then you will tell me what is not known, which is your research question or the many research questions you wanted to answer, but you will only answer one or a few. It's important that surgeons are aware of the specific complications. So this is important to identify. Then the literature of the subject is weak and insufficient. You're telling me there's not a lot. So now your small study is becoming a little bit more interesting to me. The only study published in the past 10 years was 10 years ago. Wow, that's a lot. I mean, if I want to change the policies of my hospital regarding transplantations, then liver transplant, then I need to know the epidemiology. I also would like to know what are the complications, what is the morbidity, an updated version of that. So this study might seem very relevant, and it's an observational study, but it's very relevant. And why I know it's an observational study, I'll tell you why. because I know the example, but I'll tell you. So an update of the epidemiology of post liver transplant surgical procedures seems relevant. If you haven't noticed yet, this is the introduction from the first example I showed on the tables and figures, where they show this paragraph of data, then a table that could have done with more care. And this is a great introduction. I love it. So I saved this paper as great introduction, not so great figures and tables. So it's nothing against the authors. This is a great study. It fulfills its objective perfectly, but they could have done it in a more efficient way. That's my take. And then finally, you state what is the question we're trying to answer and how we're going to answer it. So these 3 chunks of information, I think, are essential in any introduction. And with that, you have a very sensible introduction that you can replicate throughout your many papers that you're going to write. So the aim, I love how they finish this. And you will find it in different ways, but I think this is effective and tells me exactly what I need to know. The aim of this monocentric retrospective, important, it's not prospective, is to assess the epidemiology of surgical procedures. So it's not comparative, it's not prospective, it's not randomized. So it has its own limitations. You would select to report your findings the strobe guidelines for observational studies. So you will find one for cohort studies. So in this case, what I would do is go to my strobe guideline, find the one for cohort studies and say, okay, what is it that I need to report? You see, I'm tying a little bit messy, but I'm tying it with the beginning, with the results, where go to Equator, find your guideline, find strobe guidelines, find cohort studies, and follow what you need to report. But anyway, so this is a great way to structure your introduction. It's very easy to follow, and you don't have to think a lot. If you want to follow other introductions, because it's not very creative writing here, you're taking pieces usually from other papers, then a way to avoid unintentional plagiarism is to, again, reduce the phrases to short phrases. And then there's another thing. Turn the phrases around, add synonyms, and in this way you are avoiding that unintentional plagiarism. But usually you take from other articles that have been published because you're taking ideas from what is known already. So it's not creative writing, it's not your ideas that you think, oh, this could be the explanation for this, which is what you do in the discussion. I already mentioned the abbreviations. I hate them. I think they don't help anyone. So I use this rule of thumb. If you don't abbreviate more than 5 times, don't abbreviate. This also applies for the abstract. Don't use abbreviations in the abstract. When you add an abbreviation, you're adding another word, the abbreviation. So make sure that you use them wisely. And of course, if they're widely accepted, and the better. And if you create your own, make sure that if you include them in a table and figure, you add them to the legend, as I said. So the introduction shouldn't include anything that you did originally in your paper. And as I said, avoid these words because you might not be novel or the first ever. So be careful. And I would avoid starting with an abbreviation, an acronym, or a number, but it's just a question of style that I prefer. So follow the author guidelines if they say anything on this sense. And regarding the references, I'll just state that usually original articles don't have a lot of references because they're original. Everything comes from your beautiful brains, and that's why you have to set your mind to it, not to accumulating 80 references per paper. I think the first paper I wrote was like 40 references or 50, and it's ridiculous because it was a letter to the editor even. I mean, it didn't make any sense. Because you just want to include a few references in the introduction, 9 or 10, to direct us to those most important papers, and then the discussion can have that 3 or 5 articles that you're comparing against, and a few more references to support your ideas. Between 15 to 30, and some journals limit the words to 15, the references to 15. So that's challenging. So again, exercise your selection of articles you want to include in the discussion, so you don't go overboard with that references. You can find more information in clinicalkey.com on how to write the introduction, for example, and you never know what you're going to find in written by someone in another journal. It's interesting. So again, with the references, they do contain a lot of mistakes. I'm sure most of you already know this, but they must conform to the guide for authors. Every journal has a different guide for authors. I don't know why they're not standardized. They should be like something in the agenda of the American Writers Association, but they don't, or American Editors Association and European Editors Association and Asian Editors Association. They should do a standardized guide for authors. But in the meantime, we have to conform to the style given. So use a reference manager. It's the only thing I can suggest. I use Mendeley. Sometimes I use Zotero, which is also useful. Mendeley is from Elsevier. They're all free. The three, they're more, but I like these two. They're free. So use the one that you like most, but use a reference manager. Otherwise, you'll have a lot of mistakes when changing from one journal to the other, because it's not just the citation, it's also the reference itself. So everything changes. So just to end our session, very fast session, I know, but you know that those of you who are customers, Clinical Key customers, we can have tailored sessions that extend a little bit more. But this open webinar, well, we had to try to shorten it to an hour, but I covered everything I think is essential for you to keep in mind. When you suffer a rejection, it starts from an early age. Get used to it. Yes, life is about deceptions a little bit and happiness, but don't be disappointed. It happens to everyone. The last paper that I sent, I got a rejection the first time. I did follow everything that I know on how to select the right journal, but it was not the right moment for the journal. Maybe they had received a lot of submissions. So I submitted to the one they suggested, and it got accepted. So it happens. So don't be disappointed. It happens. Try to understand why. If they give you a reason, just look critically at your paper and say, it's a little bit disorganized. The tables are not that well. It has grammar mistakes. I don't know. Or my methodology is messy. Then you have to go back and redo your study. But definitely try to understand why. Read any reviewer's comments if they have given it to you. Be critical. They're not attacking you. It's not personal. The reviewers are just, or the editors are just trying their best to publish high quality work, or that is well presented, and they want the best for their journal, what they think is the best. So it's not against anyone. It's just choices. If you intend to submit your article to another journal, which I hope you always do, approach it as a new article and follow the reviewers' comments, as I said, and also read the author guidelines over and over again. Print them out, cross them as you go along. Just a few takeaways. Identify the main message of your research, not as easy as it seems unless you really started by the PICO question and you made it so clear in your protocol because you have done a very thorough research process, but sometimes it's not that easy. I have seen papers started by a database and then taken from the roof to the foundation saying, okay, but what is it that I want to tell? Is it the recovery of my patients? Is it the technique of the surgery? Is it the complications? What is it what is my main message? So identify it so you can build your story around it. Start by the tables and figures. I cannot stress this enough, how important it is. This changed my world. Honestly, I couldn't have done it differently. Organize yourself, set reasonable deadlines. You have limited time too. If you're not dedicated fully to this, unless you have 10 days off and you can dedicate yourself to writing your manuscripts. But even then, state, well, like Coursera, the first week I'm going to do the tables and figures, on and off. The second week, I'm going to write the rest of the results, the third week, and so on. Build a calendar with reminders. Otherwise, it's going to be a process that takes years. You're going to be very frustrated. Then you get rejected. And create a checklist with the tips that I give you. As you know, you can watch the session again. Create a checklist. So don't forget to describe the abbreviations. Check. The numbers have consistency with the abstract and the numbers in the text because they have to ensure consistency. Check. Anything that you think should be a rule should be put in a checklist. This is my suggestion. Just before sending, review your checklist and you'll be safe on that side. I think you should create a checklist of the medical writing parts, the proofreading part, the font type, font size, spacing, margins, tables, etc., etc. And of course, follow the author guidelines. So I've said it enough. I won't say it again. I know you have it in your minds now that you have to follow the author guidelines. But it doesn't happen always. If they say 250 words, it's 250 words for the abstract. Not more, not less, not 251. It's that strict. So follow them, please. So this was the session today. I hope you have found it useful. I will see if there's any questions that need to be answered in the Q&A. So those of you who want to stay, they can. Please answer this short survey. It's just so that we can improve and so that I can improve also. In the meantime, I'll check the Q&A or anyone who's in the call. So there's one Professor Kamal, vagus related to reflux, constipation, mood swings, and encephalopathy. Oh, my opinion on this matter. Well, it depends. I don't know if it's interesting. It could be, but are mood swings very important, relevant, significant in the country where you're writing or in the country in general? Has there been a link shown, an actual biological link shown between the three of them? Is it a review? Is it an original research? So it depends. If you find it interesting and you developed a good methodology to show this link, I would say yes, go ahead. If it changes in anything, our previous conceptions on these three items, constipation, mood swings, and encephalopathy, yes. If it's a review, okay. If it's a systematic review, yes. But there has to be a link. Initially, it looks strange. Also because constipation and mood swings, there is a lot of irritable bowel syndrome theories, but not that many treatments because it's mood. So you have to be careful to who you're addressing and who you want to target. I would say write it in a good way and decide who you want to target and where you want to publish. I don't know if this would make a Lancet unless you have a population of 23,000 people where you have tested this, or a retrospective study with 23,000 people. So it depends. It's very difficult to answer with just that information, but it depends. So let me read a little bit more, because I think you have another question. Is there any framework to guide writers for meta synthesis? I'm sure there would be, if there is, it would be in Equator. I'm sure. So I suggest you check Equator, because it will help you understand if there is. If there's a standardized one. So the good thing about Equator is that it groups the standardized guidelines, not any guideline, any guidance, right? So for example, for protocol writing, you have Spirit, and Spirit is a very standard format of writing a clinical protocol, although there are many out there, but it's a very thorough methodology that incorporates elements from the World Health Organization. It's a good one. So check that, because I wouldn't know exactly. If it's a meta-analysis, yes, there is. No health without mental health and brain health for all. Oh, I like this. I love the topic of mental health. It's just so relevant. Environment and biology can affect on brain. Yes. Is it novel? No, because there's a lot written about it. So your challenge, Professor Dr. Kamal, is to find what is that you're going to tell us different to what there's already written. The only way to do this is you have to do a very thorough, systematic search. Not write a systematic review, but you have to do a systematic search with a huge inclusion and exclusion criteria, a huge search strategy supported by a medical librarian, if possible. My recommendation, by a librarian that knows how to do it in Medline, but also in Embase, for example. And definitely make sure that what is written is going to be different to what you write. Otherwise, you're going to find it very difficult for anyone to publish it, as interesting as it can be. So find that umbrella. What makes your study or your manuscript different? If it's going to be a review, you need to find the most important reviews, most important meta-analysis, find the last day where they have been published. And if it's long ago, then yes, probably there's new data that is incoming from preclinical studies, from phase 1, 2, 3 trials, and add more information. But you have to find the umbrella, the difference in your study, and then you'll probably get published. I love this topic. It's the secret to our well-being. What can I say? How to deal with the statistics and analysis part. Oh, I don't have idea of mathematics either. So the best way to write them, it's easy. You have the protocol where you already described which statistics you're going to use, and then you follow someone else's example of a good description of the statistical analysis. Replicate, copy with your data, but copy. However, and also when you're reporting, you can check how others did it before successfully, and then you can say, okay, I can use this as a template and replace it by mine. But to select the statistical analysis and the statistical tests that you need to use for your outcomes, you need to be supported by an epidemiologist or a biostatistician. I wouldn't do it myself. I wouldn't trust myself. And there are some things that need to be reported. If you have a randomized controlled trial, you have to report the interval confidence and the P. If you're doing an observational study, risk factors, hazard ratio, or odds ratio. So there are some things I know, but definitely don't try to do it yourself, because otherwise, a bad methodology is worse than having a bad statistical analysis, because you cannot, if you select a bad methodology, you'll see this in the next month, in the next topic. If you select a bad methodology, you don't reach the outcome that you needed, so you have to redo your study again. But you can reanalyze your findings. So I suggest you look for someone to support you. When it comes to writing, use examples from the published literature. It's not that difficult. I did it, so I'm sure you can do it. Oh, the cover letter. Okay, let me answer this because it's easy. The cover letter. What is the cover letter? This is the first time I hear you need one for a paper submission. I think cover letters are very important. I think they really talk to the editor in chief. It's a great opportunity to let them know why you think their journal is the best target for and platform for your paper. So even if they don't require them, I would do it. Where you find that information in the previous session. So I already covered that, but let me type it here. So search in Editage for cover letter in Google, and it will give you a template that you can download and replace the parts for your research. And it's a great template and you don't have to add anything. But I do think it's important because you're addressing directly the editor-in-chief of the journal and you're saying, I know who you are, I know what you publish, and I think my work is so awesome for your journal that you will want it to publish. This doesn't happen anywhere else in the manuscript. So I think you should do it. It's my recommendation, unless the other guidelines or the journal thinks it's not necessary, but I think it's a great opportunity that should not be missed. Should we use more fancy looking or difficult words in our report writing in order to be published by editorial? No. Fancy words are beautiful when you're writing a book like Shakespeare. Fancy words, and I've seen this, I know some people write beautiful emails and they're like so polite, and then in science they just distract you from your results and from what you meant. Use simple, and in this way, I am sorry, but American English is more straightforward and easier to understand, and they're much more effective. So don't use convoluted phrases. This is something that has been lost. I mean, if you read articles from 1930s, yes, they are so beautiful, but how many articles were there published? They were, I don't know, I could count them in my hands probably. Now there are zillions of articles, so you need to get your message across very fast and for everyone. Why make it difficult for someone who's not native in English understand your fancy word? You want to get your article seen by everyone anywhere in the world. So do it in simple English. It's much more efficient. Yeah. Regarding the methodology, do we have to submit a PDF of ethical clearance or just state the number of the certificate in the manuscript? It depends on the requirements of the guideline. I mean, before, I didn't know there's the PDF of ethical clearance. In the methodology of the manuscript, you don't have to declare anything except that this manuscript was reviewed by the ethics committee of the hospital and was also registered in clinical trials with this number of registration, because you do have to register every single clinical trial. Human trials always have to be registered in a clinical trial database. So state that, and if it's a study in animals, animals were handled in accordance to the following declaration. So you have to state that. You don't have to send it but you have to have it if you're requested by the other guidelines. You know what I mean? So in the manuscript itself, it's a small paragraph, but you have to have it at hand. You don't have to attach it unless you're requested to by the author guidelines. Statistical analysis uses 3 variables. It requires a 3D graph to see the phenomena of the data. Yes, if your statistical analysis requires a 3D image, then you have to use it. A bar graph, so there are exceptions. So then you have to be very careful on how you want the bar graph to convey the message. So if it's a 3D bar graph, you have to state probably the number limit was, because otherwise we are not going to be able to interpret easily. So make the legend more descriptive about what you're seeing in the bar graph, or add in the bar graph enough characters and symbols to ensure that the message is given correctly. Instead of PowerPoint, which tools could we use? JImage is one software that you can use. It's a free online, very easy, basic solution to draft. You can use of course, Photoshop, if you have it. Canvas is another one, but these are paid. So JImage is one suggestion. So there's, for the results, it is useful to write the results with short titles and summarize the content of the paragraph. Yes, like I said, use short titles or titles you find interesting that makes it easy for us to understand. I mean, if the paragraph is about the efficacy of the treatment, you can say efficacy, and that's a short title. Yes. Yes, journals don't follow the same reference style. We don't know. We have to ask them all together and create a nationwide survey of why they don't follow the same style guidelines. I know. We should make a campaign. We should definitely make a campaign as to why. I know before publications, they have different styles of publications, but now with everything online, they should standardize everything. Maybe this is the future of, maybe you become reviewers and editors in chief and so on, and can change that. How long to write a good article for publication depends on the time you have. 10 days, if you have, you can just do it in 10 days. It's a possibility, but it can take as long as you want if you don't have a structure. And if you have a structure, then it's easier for you. Okay, for the figures, I already answered this. Similar lecture focusing on writing reviews? No, we can think about that, definitely. Is it better to write passive form? This is a good question, Daniela. Write in passive form. This was also something formerly used. Nowadays, I don't use it. I think you need to be accountable for your work. So we found, it's us. It's not something in the nebula out there that did it. Accountability, responsibility. So no. Am I reading first this book? Oh, creating a culture of evidence. No, this is not a book. This is a small. It's a small writing of what I do. So someone was asking about a book, but no, this is not a book. You can find books about research in Clinical Key for those who have it. So I follow many things. I keep updated. I'm currently doing a Coursera course on medical writing. I keep updating. I read a lot, but this is my job. So for you, I think reading articles, reading published papers will do the trick, because then you can see what is good writing and do it critically from a medical writing perspective, and what is bad writing. What else can I answer now quickly due to the time? Data analysis. Is there data analysis software required for public health articles? Well, it depends on the methodology you use, on your type of article. Depends on what type of article is a public health article, because you can have a public health article on antibiotic use, and then you run a survey, and then you had to do comparisons, and you had to do a statistical analysis. So if you have statistics, yes, you have to use a software. Usually, I don't know if Excel has ratios and so on, but there's, I'm sure, free software that you can run some statistics. But again, support yourself with a biostatistician or epidemiologist. Otherwise, it's very difficult to know if you're doing it right, if you're missing something, if you're missing the point, if you're getting the wrong conclusions. I wouldn't risk it. So I always, like I said, follow the guides for authors. So if you are requested to use more than 30 references in your original article, then do so. But it's rare, because original articles usually don't need that many references, whereas reviews do. So I think it depends on the type of manuscript you're aiming to write. But if that's the journal that you want to publish in, so selecting two journals that have so opposite requests. One request that you have 15 references, the other one that you have 30. well, don't choose those two journals probably, because you will find yourself with immense difficulties in trying to adjust your rejected article to one or the other. So choose journals also following the author guidelines that they select. Oof, there are so many questions. The novelty of your work without using novel, it's you stated by the gap of knowledge. You say you have done your systematic search to know that nothing has been written about it, and then you stated in the introduction, this is not known. A lot of complications have sourced from this unknown factors. Patients present complications because we don't know exactly what the risk factors for bed sores are. Imagine. So that's the way you do it. You state the unknown and you state the consequences of not knowing that. That's how you state the novelty. So about the tables, yes, there's someone has asked me the first session. Let me find it for you. The first session you can find, let me add this here in this Health Research Development Program landing site. You can watch the replay for it. Is it worth getting a medical writing? Sure. I mean, that's fantastic. I know you can do it yourself, but it saves time, although it is expensive. But nevertheless, there are some editing services that are offered by publishers, and they have different rates. So for example, if it's just a minimum, just review the wording, grammar, style, without changing anything significantly, they would charge, I don't know, 90 euros maybe. So you can check out Elsevier translation editing services, Springer, Walters. They have these services. I would say it's advisable, yes, but it has a charge. Yeah. What else can I answer now? I know I have a question. We have a table that shows educational level for our participants that are 20. Some participants have more than one educational level. Example, diploma. So I would ask, what is the purpose of showing all the educational levels? If you already have a doctorate, for example, you assume you have gone through all the before, right? Unless there's an extra master's. But even there, if you have you've seen in the surveys now, what is your highest educational level? So you might want to think about simplifying the information, because if there's any use of having all this degree and all these degrees, right? Ask yourself that. And then definitely that will never add up to 100, but it's just, you can do it. People with one educational level, people with two educational levels, people with more than two, and then you have a population, and that should add up to 100. You know what I mean? Because the population would be finite. So there are 3 people, if you have 20, there are 3 people with one, 7 people with 2, 10 people with more than 2. Well, that's 20 and that's 100. That's a way to do it. Writing drug discovery article, I'm focusing on the synthesis and explaining that it works. If it didn't have the toxicity, so I understand it's a phase 1 trial maybe. Is it enough to publish? It depends. Has it been published before? If it has been published before and you have the same findings, probably the answer is no. I know all the work that has gone behind it, but you need to find what makes it different, definitely. You need to find what makes it different from previous publications. I know anything can be published and you'll see a lot of repetition and replication, but that's not the purpose of health research. And it's not the purpose. You don't research just for the sake of researching because it's an obligation, an academic obligation. You research because it's going to be useful for someone or something or some institution. So the questions should have been asked before, is this worth doing? If you answer to yourself yes, because there was a gap of knowledge and so on, then it's worth publishing. That's the end, what I would say. Like sometime we produce 2 research papers from the same data where demographics are the same. No, this is okay. Self-plagiarism. Well, there's a software for that, and every time you publish, usually to good publishers, they check for plagiarism. So if you have already published your results, it will be rejected. Also, when you send a cover letter, you state, and you have to sign a declaration when you submit your article that this article has not been submitted before and is not being considered for publication by any other journal. So that's a declaration. So you will be committing fraud. And if you want to split your results because you think you will publish more, that's called salami slicing, salami publication, and that's highly unadvised. You should write a powerful, potent single article that gets cited many times. How do you analyze if you don't have basic mathematics? Because there's software for that. Yay. And there's people who do know mathematics. So when you have the statistical analysis, you have the statistical report. And I know how to interpret the analysis. I know how to interpret a confidence interval, a P, an odds ratio. So I understand it. And then I can create that discussion. I don't need the mathematics, which is great. What is your view on, approaching journal, the first one. Every publisher, or most of them, have a journal finder. So you'll find the journals of that publisher. So for example, Elsevier journal finder is one, but there's Walters, there's also from Springer. So you can use this. There's also another one called Jane, and you can find a journal there and read the aims and scope, most importantly, and also go to this program, because I name a lot of things important for the editors regarding the journals that you selected. Okay, that should be the first approach. Also, when you build the discussion, you'll find publications or studies that are similar to yours, so you can use those same journals to think about publishing in your study. Replication study. No, studies should not be replicated in another population. It depends. If the population that different, is that in. So this is where replication, we need to know where and when does it make sense. If it's just because they conducted it in India and I want to do it in Colombia, are the populations that different? Well, maybe they are. Maybe they have differences in nutrition, in health services, and so on. So it might make sense. So it depends. If you have a population that is big enough to add anything to the previous findings, yes. If it's adding something to the previous findings, or if it's adding more knowledge, or if it's changing in any way the results you will find, then they could be replicated. If you're finding exactly the same, your outcomes are to prove exactly the same, then don't conduct a study. That would be my suggestion. How to make the discussion concise and clear when it's not possible to place subtitles. There are two different things. The discussion shouldn't be concise and clear. The discussion should be descriptive and clear. So it has to have most of the writing of your paper, and you don't have to add subtitles. I just suggest that you follow the order of the results in which you have written the results, but you don't have to add subtitles. Tips for naming the title. Go to the Health Research and Development Program first session. That's where I give tips. Figures are actually a combination of 2 or 3 figures. Yes. The figures, yes, I did a lot of figures in electron microscopy. So they were a panel of 8 figures, for example. Just name them clearly, add a letter that is clear, that is well written, that there are no inconsistencies in where you placed the letter, the color of the letter, and also make sure that everything differentiates well. And then in your legend, you address every single image. A, B, C, D, E, F, 1, 2, 3, 4, 5, 6. Okay. And look at other papers that have the same structure and find the differences and how you would like them to look. You have to write or describe every variable, even if it didn't give results. No. If you don't have a result for the method, you don't include it. That's a fact. I mean, you shouldn't hide negative results. You should declare them and state that you didn't reach your hypothesis, okay? But if you didn't include the method because you couldn't do it because it was not feasible, then you don't include it in the methods in the writing part, yes. 15 to 30 references is noted. How many pages do you recommend? Regarding the whole manuscript, there's somewhere I found that in terms of pages. I don't know because it depends on the font. So I don't go through pages. I use word limit. So it depends on if you use 12 and 2 double spacing, it would have more pages. So it's the number of references. However, how many pages it takes, it doesn't matter. But the number of references should be between 15 and 30 unless the author guidelines state otherwise. Learn statistics. Well, you can do courses in Coursera. They're very good for statistics knowledge. And then YouTube, I find it very amusing, and you can find different people with different approaches to nearer to the way you want to learn. But Coursera for me has been fantastic. How to avoid unintentional plagiarism. Well, the method section usually is a replication of methods from other people, so it's not that important for the plagiarism. I mean, you won't, if you use a methodology that is exactly replicating someone else's, for example, electron microscopy, the protocol of the immunohistochemistry, and I copied from someone else, I should cite that person. So unintentional plagiarism can be avoided by citing the person, the authors who did the original research. That's the way to do it. The phrases you can mix and match and you can change them, but you have to cite the person. If you're stating data that is not yours, you have to cite the person. So that's what you want to be careful about, because if people take from your original article ideas and your data, you want to be cited. That's the only way of getting recognition in the research world. I study protein expression on wound healing, and this protein has never been studied on the specific wound healing before. So should I discuss expression on other types of wounds? Yes. Yes, you should. Exactly. And say, what is the difference list? And if there's none, you say it's not widely studied, but why? Is it difficult because it's not something that comes across very easily? What could be the outcome of that protein expression because it has been overlooked, or because other factors have been seen as more important? Yes, you can say this is quite novel and it's a great basic research study. So definitely comparing against other proteins that are expressed in the tissue is very important. And where is this protein expressed usually? Where else? Or why do you think it's important for healing? What animal models have used it? Or yes, I think the way you're approaching is perfect. How to get a good master's degree in neuroscience? What do you say? Get enrolled in a good university. That's how you do it. You search for a university you like, a program that you like, and submit your application. That's how it works. That's how I did it. If you want to produce few papers from your thesis, demographic data is the same. So if your outcomes are different, then it could make for another paper, because maybe your population is huge. You know, the Framingham study, they gathered hundreds of people and they had different outcomes. So they have had many publications. So you could have a big cohort, and from there you can do smaller. If you measure those outcomes, definitely you can produce more than one paper, but they have to have a different outcome, a different discussion, and a different introduction. If you can do that, then it's worth doing separate papers. And thank you for joining. Thank you for the many of you who stayed, and see you next month. That's going to give you a broad overview of research in general. No discussion on the statistical analysis of a randomized controlled trial, but it should give you a big overview of what's important in research and the research process. Thank you very much, and have a great day, evening, night.